Next on our agenda, we have journaling from GSK Representative Gabriela. She's going to teach us how to journal your lupus journey. Let's give Gabriela a round of applause.
Hi everybody, can you hear me okay or do you need the microphone? You want the microphone? Oh. Well, welcome very much. I met most of you, I think, last night. My name is Gabriela Sison. I'm a patient engagement liaison representing us in Lupus with GSK. And we have a booth up there if you haven't seen me, and I will tell you more about what we do. So today we are going to talk about health journaling. This is a very good skill that we recommend to have to help you track your symptoms and track your lifelong journey with lupus. One thing that it helps us with health journaling to know is about expressive writing. Research has shown that expressing writing is helpful and it helps you channel your emotions, your physical symptoms into a healthy outlet. And that's what we're going to learn today. How can you do a health journaling? Please keep in mind that this presentation does not replace talking with a doctor. Also, using health journaling, it is not guaranteed that it will work for you. As every lupus patient, everything is unique, everything is different for each person. It might work for some, but not for others, okay? And let me know anytime if you have any questions or you need me to repeat something, okay? Okay. So, what is health journaling? Health journaling is a tool that you can use to write down or express what you're going through. So there is a difference between a health journal and health journaling. So health journaling is the habit. So that's what you're going to get into the custom of doing this on the daily or weekly basis. Make it part of your life. That's health journaling. Health journal is the actual tool that you're using to get into the habit. So it could be something tangible, like a book, a diary, anything that you can touch to write hand on. It can also be on an electronic format, like your app on your phone, your tablet, your computer. And some people like to use like a spreadsheet or like something that guides them through it to do the journal. Whatever option you choose, it has to be something that works with you and your lifestyle. So, for example, my health journal that I have is on my phone, on my memo app, and then I write over there as I go because I'm always on the go. I don't like wearing purses, and I always lose paper. So it's just depending on your style. Also, if you cannot have a journal yourself and you have a caregiver or a loved one that's managing that for you, talk to them, see what works best for them, and then you set up a plan. You want to meet a certain time every day or a certain time every week where you can sit down together to write down what happened. And also, the other thing about when you're doing the health journal, you have to have a system for tracking. So, what will you put on it? You will put your medications that you're taking, you will put any symptoms that you're having. When we're talking about symptoms, it's really good for you to talk to your doctor to see what they're looking for. What do they need to know? When I was talking to a lot of you last night, I hear there was a lot of disconnection between the communication with your doctors that you felt. Some of you told me you felt like they were not listening to you or like there was such a rush. So you had to advocate for yourself. You had to be like, listen, let's have that hard conversation. It seems like you're not paying attention or I don't feel like you're listening to what I'm saying. What do I need to do to give you the information that you need to listen for? So, for example, with my one of my specialists, we look at what time did the symptom happen, what I was doing when that symptom happened, what did I eat, and how did I feel. So that's what I write in my phone when those things happen. The other thing is your symptom triggers, and that goes again like what were you doing? Would it be like environmental trigger, an emotional trigger, a situational trigger? So just think about what you were doing. You also want to keep track of your test results. So document them, keep them on your health journal. And most importantly, your mood, your mental health. I was on a session a few months ago, and I love what these doctors say. Your brain is part of your body. So we had to take care of it as we take up other body parts. He, he was so funny. He said, it's not like you had diabetes and you go to the mirror and look at your pancreas, area of the pancreas, and be like, well, pancreas, start making some insulin. What's wrong with you? And that's the same with the brain, right? So we tend to kind of have like a little taboo about the mental health, and it is really really important to look into that because all of that comes together into having a healthy life. So 7 out of 10 adults in the United States, they either keep track of their health through a journal or a symptom tracking, or they do it for someone else, and that's where your caregiver and loved ones come in. Okay. So we find out on those research that most of what the people put on their journals is their mood, their diet, and their exercise. While 1/3 of those people, we talk about blood pressure, sleep patterns, headaches, and any other symptoms that they're having. So why do we want to use a health journal? So first, we want to monitor your signs and symptoms. Most of us, we already know that lupus is a very hard disease to diagnose. And most of it is because it's driven by signs and symptoms that you haven't. So also we want to recognize the triggers. And this is where we talk about environmental. Could it be change of season, a food allergen, anything like that? Think about what is changing on the area that could be triggering. We also have the emotional trigger, any minor or major stressor in your life, any emotion that could be a trigger as well. And we also have the physical triggers on it. So coping with difficult emotions, that will be also considered an emotional trigger there. Keeping track of medications, we already mentioned that. When we talk about medications, know the name, know the dosing, know their side effects, know how long you're expected to see any results from those medications. It's going to help you in the long run to know what to expect for your treatment plan and to be like, maybe something is not working. Okay? Don't go to the hospital and be like, oh, I don't know what I take this for. So you need to know your medications. Preparing for your doctor and medical appointments. This is really, really important. I personally have ADD, so I'm very distracted. So I always need to use a lot of behavioral techniques to keep me in check. And that's why before I go to doctor's appointments, I sit down, I look at what happened during my last few months since I've seen the doctor, and I set up questions. And I even talk to my husband because he's the one that helps me when I'm not feeling good. I'm like, what else am I missing? What I need to ask? Because when I see the doctor, I'm very chatty. So then we start talking about my dogs or something else. And then I leave the doctor appointment. I'm like, oh my gosh, I forgot. Who has done that? Right? So, so yes, you have to. And especially when you have, like Suzanne was talking about yesterday with the lupus fog. We call it brain fog. I do it, but we had to keep all of that in mind. And that goes into remembering the questions for your doctor. Prioritize the questions that you have and know what your doctor do. If you know you're going to see your regular doctor, you might want to have questions more like generalized questions instead of being more like specialist questions. So because then they're going to be like, well, you might have to go to the other person. So know what the purpose of the appointment is. And be an accurate picture of your health, building an accurate picture. This mean is get creative. Do what works best for you. If you're like those people that like to do pictures or calendars, uh, mind maps, bullet points, you like to write the whole sentence or like a whole book about what your journal is, just do it, but do it the way that works for you. Do it a way that keeps you entertained. I try when I was doing therapy for learning for how to control my distraction. They wanted me to do a journal every day, and I found it difficult for me because I was like, all over the place. But then I was like, oh well, bullet points. Bullet points will like keep me on track. Like two words, boom, I remember. Ta 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 ta. So bullet points were better for me. So it is going to be like a trial and error technique first. You're going to try different techniques, talk to your support group people, see what work for other people, and then until you find something that likes it. Again, journaling is a habit. So it's like exercising, dieting. It's going to be hard at the beginning, but the outcomes could be very beneficial to keep track of your treatment plan. So, how do we start a health journal? Choose your format. This is the first step that you had to do. And that's what we were just talking about. Find the format that best work for you. Either writing down, electronic, or have your appointment buddy or the appointment buddy. I don't know if anybody knows what I mean with that. No. Appointment buddy is something that we like to use on my group a lot. Is when you teach that caregiver to be the support person and to be like the person that's going to be backing you up when you go to your doctor's appointment and be like, hey, let's ask this to the doctor. You were feeling this last week. Let's see what's going on. And so that's what we teach to the appointment buddy. But that's another session. But that's what I meant with that. Sorry for the clicking. Next, you have to include your health history. You have to be very detailed. Again, this is not replacing your medical record, but include your health history, your family history that's relevant to you. I met a lot of people yesterday that a lot of siblings had lupus or their mothers had lupus. So you just have to include all of that. Um, Again, medications, as any signs and symptoms, triggers, all of that. You have to include everything. And very importantly is write down your goals and values. One time I was reading this book called Rethink, and it was talking about how your beliefs always changing, but your values always stay the same. And this is the same with the chronic illness. We go through so much hassle. There is a lot of obstacles and barriers, and we cannot let that to redefine our values. We just have to rethink, okay, I cannot do it this way because of this limitation. Let me find the other way. And that's why you like rethinking your beliefs. You're learning new information with what you're doing here. And with that new information, you can see, okay, let me rethink my belief. It's not what I always thought I could do it that way. That also comes in depending of your household situation. You have in your household, you have a role to play, correct? And your role is going to change depending on what you do. If you were the main provider, it might have to change. Or if you were the main person that did the cooking, it's going to change. But your value is still the same. You just have to rethink like how in the family we're going to keep this harmony in the house with these new adjustments. So think about what your values are, what your goals are, and personally and with your disease process, okay? How do you track your health journal? Signs and symptoms. Symptom triggers, that's the big one because that's the one that you want to know if the medications that you are working, if what your treatment plan is doing is working. And this is, again, what I want to repeat is ask your doctor, if I'm taking X medication, how long till I see a result? When you had that realistic expectation, you're going to have a better outcome, and you're going to follow up on your medication, and you're not going to do a medication vacation by like being, oh, I'm not going to take it. So side effects of your medications. You need to know what the side effects are. Do not assume that your feelings are because of lupus, what you're feeling or what your symptoms are. Write everything down and let the doctor see, is it lupus or is it my side effects or what we need to do. Okay? Mental and emotional state, the same. This is just a little recap. You want to address how you're feeling. Journaling is a very good outlet to get that stress and the anxiousness to leave your body. When you write it down, if that works for you, it's a good way to talk. I was talking to some people yesterday, and she was sharing the story about how it helps her to write every night before she goes to bed, to write every night what she was feeling, and it makes her more calmer to go to bed. So just think about that. How it is impacting your life. And we're talking about every aspect, socially, with the family, with work, with yourself internally, how this is impacting your life. Because if you know how it's impacting your life and you can express that better to your doctor is going to be able to help you. Keep in mind, your doctor is seeing so many people. After COVID, the doctor's access is even more limited than before. It's even harder to get in. So let's, all of that you have to help you to keep in mind. And this is one of my favorite helpful practices. And this is called gratitude journaling. When you do gratitude journaling, you're just not focusing on my symptoms, my triggers, all the pain or what is happening. You're giving yourself a break. You're being kind to yourself. You are celebrating any little win that you have. So if you today didn't haven't had joint pain for a week, that's a win. That's something to be grateful and gratitude for. You know, if you have a pet and your pet smiles at you and that gives you joy to look at your pet smiling, write it down. Use remember yourself. We like to do something like three things that makes you smile that day. Three things. Just think about it, and that's when you want to do gratitude. And how do we make the most of your health journal? You make it a habit. You become health journaling a specialist. You make it work for you. If it doesn't work for you, it's not going to do anything. It's not going to help you. It's going to add more stress. So try it, make it work for you. Talk to your loved ones to see how you can move from that. And the most important part here is make it part of the conversation. What I mean here is you're going to use the health journal as a tool to communicate with your doctor. You're going to review it before you see your doctor. You highlight the areas. And if you don't know how to talk to your doctor, ask them, what do you need me to do before or during the appointment so we can have better relationship? I, for example, have two different doctors. One is my primary doctor, and we just have a professional relationship. So what I do is through my chart, I send her my symptoms and what's happening before my appointment. And that way she can kind of review it really quick before she sees me and she has an idea what's going on. My specialist doctor, we used to work together and we became good friends, so we have a different relationship. And I have her cell phone, so what I do is I send her screenshots of my journal with my symptom tracking the day before my appointment. I only do it the day before. Other than that, we just talking about families and dogs. But that way, she already has a plan like, okay, this medication is not working. Let's try something else. And so those 15 minutes that I'm with her that I can talk about my health and other things, she's focusing on like what has happened. But again, this is something that I had to talk with each doctor and establish the rules and the standards of our relationship. So you need to do that. We are talking about we're dealing with someone with different culture, maybe with different beliefs, with different ways of communicating. So that's why it's important to have those conversations and see how are we going to do our relationship. And this can help you be part of the conversation. So it's a very good tool again to prioritize your questions that you need to ask your doctor. So lastly, um, I'm not going to spend time here because I'm right there, so you can come over and I will tell you all about our resources. But we are a group of nurses. We do educations and free tools for lupus, including caregivers, loved ones, and things like that. So come and see me. But before I leave or start asking or let you guys ask me any questions, who is doing health journaling? Three? Three people? Anybody else doing like symptom tracking or anything? Take notes. Okay. So for you that you're doing health journaling, have you find it like any what is working, what is not working with your doctor? Mm-hmm. Mm-hmm. Yeah. And the more that you get used to it, the better you're going to get at it. Like mine's very simple because I just had the date, the abbreviation of the body part that's having the pain and the pain level and what I was doing, like in 2 words and things like that. So that's why it's like a very quick look. So yeah, you had to because you're not going to remember your pain that you have a week ago or 2 days ago. You're just going to be thinking about what is happening within the last 48 hours or so before you see the doctor, right? And then you're like the doctor is throwing you so much information and other things that you feel like I feel like as a patient sometimes that I couldn't speak up, I couldn't show my voice, and that's the good thing of the habit. Um, yeah. Mhm. No. And I think a lot of people here with their family members. Have you thought about talking to your family members to be like, hey, have you noticed anything that you would like me to ask the doctor about myself or anything? Because sometimes we don't notice because we get so used to dealing with it and we just brush it off. But maybe your family or loved ones would notice. Have you guys done any of that? Okay. Mm. Yeah. Yeah, that's really good. We have uh no, we don't. So what we do is we do on gskpresshub.com, and I can help you that before you leave. We do webinars every month, and we change the classes, and you can come over and then you can do it from there if you want. And we have 5 nurses in my team, so there are different different teaching styles, so you can try any other the nurses, and we can talk about that. Yeah. Um, yeah. Yeah. And that's something that's like a really good thing, like maybe set the time like once a week or a few other weeks, and talk to your loved ones and be like, okay, what should we write down about what are you feeling from my lupus, and then that you can add it to your journal and then take it to the doctor and see, okay, what else we can do, because then yeah, we don't notice. So yeah, thank you for sharing. Yeah, and with that, your doctor can also recommend to see maybe like about, doing like some therapy to help you like with some techniques to help you like calm and stuff like that. Yeah, mindfulness. Yeah. There is there is this website that they teach you like 7 tricks of mindfulness. Is that the one you're talking about? It's a gentleman. I forgot his name, but yeah, I used to use him. He's really good. Yeah. So, mhm. Oh. Mm. Well, it's funny that you say that because that reminds me when I used to work in patient nurse in the hospital. So I was that person, like because I was with the patients for 12 hours while the doctor was there for 5 minutes, and I would see the people in pain and the emotional distress. So before the doctors go into the room, I would talk about it, be like, hey, this person, they're having so much pain. I don't know what else to do. Can we try to change something? And then we go to the room and like, hey, Alec, how you doing? Oh, everything wonderful. I'm having the best day. And I'm like, I swear I'm not lying. They've been complaining all day long. And I'm like, you're complaining to the wrong person, because if you don't tell this doctor, but then, it's like the culture, the custom, like, I don't know. It's just weird. Yeah. So, yeah. Any questions? Any other comments? Anything you would like to share? Who is going to start journaling or trying? symptom tracking a list, journaling. Yeah. Um, um, so we have Adrian. She's going to. Should you say that since it's your guys' gift? Okay.
Let's give Gabriela a round of applause. Thank you. And as Gabriela mentioned, Adrian is passing out some journals so you can start journaling your lupus journey today. We're going to take a brief pause.